This won't create sustainable growth, it won't shrink our deficit, and it won't create jobs. And that's why we put an end to the status quo that got us into this crisis. We cannot turn back to the failed policies of the past, nor can we stand still.
President Barack Obama choosing to accentuate the positive today, focusing on a better-than-expected jobs report. Better than expected. But should he have called for calm in the town halls? Is the president actually leading on? Is he actually not leading on health care? Yeah. We're back now with our town hall panel. Democratic Congressman Dennis Kucinich, Republican Pete Hoekstra from Michigan, Dr. Erica Schwartz, Chief Medical Officer at Synergy Health, and Dr. Mark Siegel, our own Fox News medical contributor. All right, and I do believe we've got yet another guest to ask a question of the panel. Please introduce yourself and ask away.
My name is Betty Yokel, and my question is this. The more I read on the issue of health care, the more confused I think all of us are. I think it's an issue that's been very hard to address, to simplify. I am on Medicare, and I have a Medigap, so I don't have a real problem. But my concerns are for the working families and those that are disadvantaged. How do you tell your constituents in a simple way what is going to be required of them monetarily on this new program?
That is great.
Representative Kucinich, we've talked about this, and again, a lot. And if you could address this, the blue collar down to everybody is very confused about what is on the table these days. Can you break it down for us?
Well, I'll try to make it as simple as possible. Under the present system, people are paying more and they're getting less. 1 out of every $3 goes for the for-profit system. Health insurance companies make money not providing health care. The reform proposal, H.R. 3200, which I haven't said I'm supporting yet, says that people will be getting more, but they're paying less instead of paying more and getting less. So that's basically, we're trying to cover more people and make sure people would pay less so that people aren't going broke as they're doing now in the present system.
Dr. Schwartz, I can tell you're getting animated over there. Take it up from there.
How do we do that?
How do we do that, Congressman Kucinich? I mean, that's just it. In a 1,200-page bill that's been written by the lobbyists themselves, it's hard to believe that that's actually going to be the result.
How is the single-payer system going to make it better? How?
Because it eliminates the for-profit insurance companies. It takes the $800 billion a year that they get and puts it into care, and then everyone's covered, and you don't have to increase the cost, the spending. You could cover everyone for their basic health care needs, and that saves workers plenty of money.
Dennis, I love you, but man, where is the example where we have put the government in place, taken the profit motive out, and increase the service and the quality? This is going to lead to poorer, less quality health care. We've got the best quality health care in the world today. The piece that is broken is how we compensate the various providers and how we put money into the system. And taking the profit motive out and saying the government's going to run this. Government can't even run a rebate check for the cars.
But Dr. Siegel, you're a doctor. I mean, I saw a study recently. 5 out of every 6 doctors prescribe more tests than necessary just to cover their butts because of malpractice.
Okay, so let's talk about all this. First of all, the reason the woman that just asked the question is confused is because of this. I'll tell you why people are confused. The discussion has been about health care, but it's really about health insurance. Let's be honest about this. Let's be honest about this. Insurance does not equal access to care. If I'm a physician and I don't want to take your insurance, and I have to tell you there's a big problem with that. More than 50% of the physicians in this country are not accepting Medicaid.
Right.
In many areas, 2/3 of primary care physicians are not taking new Medicare patients. If we switch to a public option or even single payer, doctors might not decide to go for it unless they're forced to, and they may not then decide to go into primary care even then. We do have a system that's very inefficient. There's a lot of overuse in the middle. Listen, patients come to my office all the time that don't need to be there, and I don't trust the government to be able to fix that. They're going to deal with the extremes of the problem. Representative Kucinich, they're going to say, you can't have that MRI, you can't have that colonoscopy, but what about the people with a common cold that are flooding the doctor's office?
All right, guys, I tell you what, it's getting heated up in here. This is how the town halls, I do believe, around the country are supposed to be. Intelligent, nice debate. 1 second, Congressman Kucinich, I want to get
Both are bad. Both are not bad.
I want to get one more guest in here, guys. Hold on. We want the people to talk.
All right.
Get it. Please introduce yourself.
Tell us your name first.
Helena Lupo. I'm on Medicare. I have no problem My concern is because there's so much politics going on, and the amount of people who are suffering, they don't have no health insurance whatsoever. What is the safety net for them?
I'd like to take that one. You know what? If we wanted to get serious about this problem, we would create a task force of primary care doctors paid for by the government, pay for their education, pay for their first few years in practice, build clinics for them to take care of the uninsured. That's how to solve this problem, not with an insurance solution.
All right, guys, we're going quickly around the horn. Dr. Schwartz, you hit it.
Remember what I said before, it's about the doctor-patient relationship. At the end of the day, it's not about politics. We're making it about politics. We're making it about special interests. We're making it about government. But what happens in the office between the doctor and the patient is what's sacred. You said you loved your doctor. You know what? We need all the patients to love their doctors. We need the doctors to love their patients.
I love my doctor because it's Dr. Siegel. Representative Kucinich, we're going to give Dr.
This is the way to do it is you have to bring them together. You got to eliminate the middle people.
We're going to give Representative Hoekstra the last word on this one, so you get to go next, Representative Kucinich. Congressman Kucinich, your turn.
Yeah, let me just say that the problem is people can't afford the premiums, and they can't afford co-pays and deductibles. That's why you have people uninsured, and that's why you have people who are underinsured. We've got to get rid of this for-profit insurance system, which is driving this country into economic ruin. It's hurt businesses, small and large businesses alike, and it's hurting individuals. People are losing their homes, they're losing their retirement security because they can't afford to pay medical bills. Now, this is all the big for-profit insurance companies. They want to keep things the way they are, and the way they are is morally wrong.
But Representative Hoekstra, the question was, what's the safety net? Where's the safety net?
The safety net is an inefficient safety net, which means that if you don't have insurance but you get ill, the emergency room will treat you and take care of you. That's an inefficient way of managing the system. We do need to give these people coverage. There's a lot of different and alternative ways to do that other than turning it over to government and have government run that system. And that's what we're working through, and that's why I'm glad you asked the question.
Great question,
Thanks
guys.
for your question, and thanks to the panel. I'm loving this. All right, and we have much more ahead on this special happy hour town hall meeting. We will hear more from our panel as the show continues, and on tap, are unions using violence to get their point across at town hall meetings? Mark Brennan, Director of Labor Notes, helps us sort that out. We'll be right back.